Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The State Trait Anxiety Inventory assesses both temporary and long-standing levels of anxiety in individuals. It measures state anxiety, which reflects how a person feels at a particular moment, and trait anxiety, which indicates a general tendency to experience anxiety across situations. The tool is used primarily to identify the severity and characteristics of anxiety symptoms related to anxiety disorders and other psychiatric conditions. Its main purpose is to aid clinicians and researchers in evaluating anxiety for diagnostic, treatment planning, and outcome assessment purposes. The inventory provides quantitative data on anxiety levels, supporting evidence-based clinical decision-making. The State Trait Anxiety Inventory is indicated for adult patients experiencing anxiety symptoms across a range of clinical populations. It is commonly used in patients with anxiety disorders, depression, post-traumatic stress disorder, and chronic medical conditions where anxiety influences treatment outcomes. The inventory is most useful in clinical contexts, requiring differentiation between state anxiety, which reflects transient emotional responses, and trait anxiety, which indicates a stable predisposition to anxiety. Its application aids in assessing anxiety severity, monitoring treatment progress, and guiding therapeutic interventions in both psychiatric and general medical settings. The State Trait Anxiety Inventory consists of 40 items, divided evenly into two separate 20-item scales. One scale measures state anxiety, which reflects the current level of anxiety experienced by the individual, while the other assesses trait anxiety, representing the general propensity to experience anxiety across time. Each item is a statement describing feelings related to anxiety, with respondents rating the intensity of their feelings. The State Anxiety Scale uses a 4-point Likert-type response format, ranging from not at all to very much so. The Trait Anxiety Scale employs a similar 4-point format, indicating frequency from almost never to almost always. The administrator instructs the individual to complete each scale independently, emphasizing honesty and current feelings for state anxiety and general feelings for trait anxiety. After completion, item scores are summed to yield separate totals for state and trait anxiety, with possible score ranges from 20 to 80 on each scale. Scores below 39 typically indicate low anxiety, scores between 40 and 45 suggest moderate anxiety, and scores above 46 reflect high anxiety levels. Interpretation must consider the clinical context, as higher scores may warrant further psychological assessment or intervention. The State Trait Anxiety Inventory demonstrates variable sensitivity and specificity depending on the clinical population and cutoff scores utilized. Sensitivity refers to the instrument's ability to correctly identify individuals with anxiety, meaning its true positive rate. Specificity indicates the ability to correctly identify individuals without anxiety, representing the true negative rate. In clinical studies involving patients with generalized anxiety disorder, the State Trait Anxiety Inventory has shown sensitivity values around 0.85 and specificity values near 0.75 when using recommended threshold scores. For example, a sensitivity of 0.85 indicates that 85% of patients with anxiety are correctly identified by the inventory, while a specificity of 0.75 means that 75% of non-anxious individuals are accurately classified as not having anxiety. These metrics highlight the tool's effectiveness in screening, but also underscore the need to interpret results alongside comprehensive clinical evaluation. The State Trait Anxiety Inventory was developed in the mid-20th century by Charles D. Spielberger and colleagues to distinguish between temporary condition anxiety and more general and long-standing anxiety proneness. The instrument has undergone extensive psychometric evaluation, confirming its reliability and validity across diverse populations and clinical settings. Internal consistency estimates for both the state and trait components commonly exceed 0.9, indicating high reliability. Test-retest reliability assessments demonstrate stability over time for the trait anxiety scale, with coefficients often reported above 0.85. Construct validity has been supported through factor analysis, correlating well with other established anxiety measures and differentiating anxiety from related constructs such as depression. Normative data collected from large samples, including healthy individuals and clinical populations, provide benchmarks for interpreting individual scores. Additionally, cross-cultural validation studies have affirmed the tool's applicability in various languages and cultural contexts, supporting its use in international research and practice. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.